Welcome. Thank you for considering us in your search for complementary health practitioners in your clinic. We believe integrative nutrition will benefit your practice and your patients so much, and we are excited to present this information to you. Because we value your time, we will provide your team with brief summaries of the history of food used as medicine, our philosophy, our scope, a study showing the benefits of adding nutrition to your medical approach, and our plan to complement other healthcare professionals in your clinic. We plan to show you that integrative nutrition is more than going on an unsustainable fad diet. It is actually an evidence-based scientific approach that benefits the health and wellness of the whole person. We hope you see the benefit in this collaborative effort. Integrative nutrition uses a partnership between conventional and evidence-based alternative medical interventions to support a holistic approach to wellness that includes the patient. Most do not realize that conventional biomedical practitioners are not well trained in the area of nutrition. Our team sees integrative nutrition as a way to have a partnership between conventional and evidence-based alternative medical treatments that support a holistic, patient-centered approach to wellness. The use of food and food derivatives as medicine has been a practice for thousands of years all over the world. Eastern medical systems such as Ayurveda incorporate nutrition, and even Hippocrates coined the phrase, quote, "Let food be thy medicine and medicine thy food." The world has known and been able to correlate diet or nutrition to health and wellness for a very long time. Even in the United States, doctors recognized diseases can be caused by mineral deficiencies and started treating patients accordingly. Agriculture schools even taught classes that led to a career in dietetics. Over time, though, gaps developed, and despite those gaps in nutrition causing or at least contributing to chronic disease and conditions, when patients go to their doctor for care, they are usually prescribed pharmaceuticals instead of being advised on the many alternative options. Goswami and Ram, after their research, said, quote, "Food can be medicine, but medicine cannot be food." We are dedicated to helping our patients obtain optimal health through whole person, patient-centered care using evidence-based interventions and a strong patient-practitioner relationship. We want to enhance the scope of your clinic with our expertise. We are beginning to understand and appreciate the healing power of nutrition. And as we begin to shift our relationship with food and begin to see food as medicine, we can welcome nutrition into a larger conversation with healthcare, exploring how a patient's diet can influence their healing, reduce pain and inflammation, help with weight loss, and even improve their social emotional well-being. So we see 4 main steps. How can we integrate nutrition to make healthcare better for our patients? We can collaborate with other healthcare professionals and the patient, come up with a plan, and then engage complementary and integrative healthcare practices. As an integrative nutritionist, I promote optimal health by consulting individuals, families, and groups on improving diet, lifestyle, and attitude. The integrative nutrition approach is designed to improve overall health and function. This may follow a cross-professions evaluation in several methods, such as gastrointestinal health, hormone balance, inflammation levels, immune function, cardiovascular health. While a biomedicine practitioner may diagnose an illness, as a nutrition professional, I can evaluate the biochemical imbalance and the toxicities that may impact the conditions. Collaboratively, a complete intervention plan is designed to heal the imbalance and confront the root cause. As an integrative nutritionist, I can focus on advocating for the benefits of whole foods diet and may suggest herbal supplementation as a preventative method, as well as therapeutic. How do the key concepts of integrative health show up in integrative nutrition practice? Well, my whole person care practice acknowledges the connection between nutrition status and mental state. Therefore, improving patients' attitude is a major part of my scope. In my patient-centered care, the patient is an active part of the evaluation and the treatment. I heavily rely on a detailed patient questionnaire, diet diaries, and client reports while designing strategies based on their customized needs. I strive to reach patients with optimal health by building physiological immune resilience to handle any obstacle that may arise. My practice is also evidence-based by building a plan of care formed on meticulous scientific research while incorporating individual preferences, traditional customs, and clinical assessment. I like to spend a sufficient amount of my time also building relationships with my patients. Our patient-practitioner relationship is incredibly important. So the different kinds of services that are offered range from diet and lifestyle evaluation, teaching healthy eating, going on shopping tours, customized meal planning, making suggestions for improving the lifestyle, supporting a healthy stress response, and customizing those meal plans for improved weight, mood, and energy, depending on what they need. I'd also teach classes on wellness and holistic nutrition and advise clients on basic wellness supplementation. So here is a 4-year randomized control trial, a case on nutritional therapy for high blood pressure. The purpose of this trial was conducted to discover if less severe hypertensives could discontinue medication using nutrition to control blood pressure. If nutritional intervention proved to be effective, then medication could be eliminated entirely, or if it's still necessary, could be used in much lower doses. The intervention dialed in on 3 factors, which are weight, sodium intake, and alcohol intake. And then men and women aged 35 and older were placed in 3 randomized groups. Group 1 was a nutritional intervention group where intervention was implemented throughout the trial with a withdrawal from antihypertensive medication after 8 weeks. And then group 2 had no nutritional intervention. Antihypertensive medication was eliminated after 8 weeks, and this was to determine if previous good blood pressure control made it possible to maintain a normal range without drug or nutritional therapy. And then group 3 was our control group. No nutritional intervention at all, and participants remained on medication. And then, of course, it's important to note that to minimize risk, groups 1 and 2 would resume medication if blood pressure significantly increased. So here are the results. Throughout the trial, the group that was able to have the highest percentage of maintaining normal blood pressure levels without medication was indeed the group with nutritional intervention. It's important to mention that the dietary recommendations were not extreme. A protocol simple enough to serve a range of hypertensive patients was used. At the end of the 4 years, 39% of group 1 participants had an average weight loss of 4 pounds, with 30% of the group losing 10 pounds. They had the highest decrease in alcohol consumption and a significant decrease in sodium levels, a 24% increase in potassium levels, and improved cardiovascular health overall. So group 1, which again was the nutritional intervention group, was 8 times more normotensive than that of group 2, which had no nutritional intervention. Those that resumed medication were severe hypertensives or more overweight from the start of the trial. However, a reduction in side effects was reported as a result of those dietary changes. For group 2, prior good blood pressure control proved to not be sustainable over time when medication was eliminated without dietary changes. Groups 2 and 3 had a 4 to 5 pound weight gain as well as an increase in sodium levels. The study concluded that nutritional intervention is effective for hypertensives and could be used as an initial step in treatment. Other studies have comparable results showing scientific evidence of the benefits diet has on controlling hypertension. So Liz Lipsky explains the necessity of taking a holistic approach to supporting a client in their care. Any intervention, she says, and support should consider the person's needs across all of the dimensions of health, including the physiological, psycho-emotional, social, intellectual, and spiritual. Holism seeks to understand the entire person, the mind, the body, and the spirit, rather than simply exploring the disease. This holistic approach, rooted in traditional medicine practices, is defined by the whole being greater than the sum of its parts. The biopsychosocial model inspired by Engel, who believed that there was more to patient care and disease than molecular biology, looks to explore how social, emotional, and environmental or physical factors and their interrelationships may impact and influence disease. As healthcare providers work to support patients with their chronic illness or health concerns, working collaboratively with a nutritionist and other complementary health practitioners to create an individualized interplan is ideal. It's so essential to widen the view of the patient's care beyond the disease. As patients work to manage chronic illnesses such as IBS, diabetes, arthritis, high blood pressure, or high cholesterol, or any disease that impacts the autoimmune system, their diet and how their body breaks down and processes nutrients must also be assessed. For instance, an arthritis patient may be working to reduce inflammation in the body. They may see a primary care physician who recommends a multimodal approach to their well-being. The patient might work with a massage therapist to get the body into a parasympathetic state, a state ideal for healing, and a state that can help to boost the immune system. Working to manipulate soft tissue as well may improve joint mobility. Working with a nutritionist could help the patient pinpoint foods that are causing inflammation in the body and identify foods that could help reduce that inflammation. Working with an acupuncturist would help the patient get to what Millicent calls the roots and branches of the illness, that which is causing the symptoms, as well as the physical and energetic disharmonies in the body. And the patient might even seek out a health and wellness coach to help and support them with their plan and overall goals for well-being. Integrating nutrition truly benefits the client and the healthcare system. As Liz Lipsky says, the growing awareness of nutrition's role as both a preventative tool and an intervention will become critical to study and to implement as appropriate in a population in which chronic disease and an epidemic of obesity plagues many and costs the healthcare system an inordinate amounts of money, like trillions. It truly behooves the client and the healthcare system to collaborate in patient care. When we have resources that can be a vital piece of the puzzle in supporting a patient's healing, it is essential, even imperative, that we expand the view of their care and integrate all available resources and interventions to serve them. Nutrition is a primary support system tool for all of us. What we take into our bodies as fuel influences how we feel. When a patient is struggling with health, we must also assess their diet. Working with an integrative nutritionist can make a difference in their overall well-being and improve their quality of life. We really appreciate your time and attention listening to us explore how working with an integrative nutritionist can really benefit your practice and dramatically improve the well-being of your clients. Thank you so much for listening.